Good afternoon and welcome to everybody. Can I welcome all committee members and officers to today's Healthier Communities Overview and Scrutiny meeting. I'd like to remind everybody that this meeting is being webcast. Therefore, can I please ask you to either put your mobile phones into silent mode or to switch them off. And when you do speak, to ask or answer a question, please speak clearly into the microphones. As a council, we welcome the use of Welsh language within our public meetings, but I can confirm that we haven't received any requests or notifications to use the Welsh language today. Therefore, this meeting is going to be conducted in English only. Can I also please remind all members to sign the attendance register and ask Geraint to confirm if we've received any apologies for today's meeting.
Thank you, Chair. Yeah, we've got apologies from Councillors Jeremiah and Molson, and I also know that Councillor Rose Seaborn is in a foster panel, so she may just be a little bit late coming into today's meeting.
Thank you. Next item, declarations of interest. Could I also please ask if any members, if they do have any declarations of interest, they declare them now and record them on the declaration of interest form in the folder. Next item, minutes of the meeting held back on the 20th of June. These minutes relate to the update on recommendations report and also the update on adopted action plans report considered at the meeting on the 20th of June 2019. Could I please ask members to scan through the minutes of the meeting for accuracy and confirm that they represent an accurate account of the meeting that took place.
Yes.
That's noted. Thank you. Next item is the action sheet. Rebecca, please could you inform members of any updates on the actions outstanding?
Thank you, Chair. So as members will see from the agenda pack there that both the action points have been actioned. So I don't have anything further to add to that unless members have any questions.
Members, any questions? Okay. The next item on today's agenda is dealing with the Care Inspectorate Wales inspection findings in regard to prevention and promotion of independence for older adults over 65 living in the community. Adult Services was subject to an inspection carried out by the Care Inspectorate Wales, CIW, and Health Inspectorate Wales, HIW, in July 2019. The inspection and subsequent report, detailed in Appendix 1, recognised the positive work that staff and partners are undertaking. The purpose of this report is to set out the findings of the inspection and provide members with the action plan to address the recommendations and proposals for improvement. I would like to welcome Jill Pratlett, Head of Adult Services, to the meeting. I'd also like to welcome Anne Rowling, Senior Manager, Local Authority Inspection, Care and Inspectorate Wales. And can I please ask Jill to provide members with a brief overview of the main points within the report.
Thank you, Chair. I take it obviously everybody's read the report. As the Chair has already outlined, the inspection was focused on older people living in the community, and when I say living in the community I mean those people in their own homes, and it didn't include anybody within residential and nursing care. Along with the principles of the Act, the inspectors focused on 4 areas during the inspection, which was around well-being of the older people in Torfaen under the support of Adult Services. They looked at people from the perspective of their voice and their control of what was happening around them. They looked at partnership, integration and co-production of services and how we kind of work to that in day to day. And lastly, they looked at prevention and early intervention. And they came from that in, I guess, from three perspectives. From that of the individual, so that is about the individual practitioner, about when they looked at case files, what was that individual person doing. They came from that from an operational perspective, is how did we, as adults in adult services, how did we function on a day-to-day basis in the teams and in our directorate, and then from a strategy perspective. So how are we working with, what is our long-term focus, what is our strategy, what was our, certainly our long-term focus there. What the inspection, I would say, and I might have a different view, but I think it was quite intense. It was over a 2-week period, and that happened in July of last year, which seems a long time ago now, with 5 inspectors that were part of that inspection, 4 from CIW and 1 from HIW. And as part of those 2 weeks, the inspectors looked at case files. So prior to the inspection, we were asked to provide, I think it was 60 case files, and which or a number of names were that the inspector then picked 60 case files, and from those 60 case files, the inspectors reviewed those files. They followed up, I think, on 16 of the cases where they went to interview those individuals and their carers. They observed and spoke to practitioners. They went to fish bowls. They interviewed senior managers, certainly exec members, 151 officers, financial officers. They spoke to providers. So those those people in the third sector that we work with who provide services. They spoke to volunteer organisations in TVA, and they spoke to a number of other partners, particularly in the Health Board, around our relationship with an Iron Bevan Health Board, again at those 3 levels around the individual, the operational and the strategic. I won't go into any more detail of the actual process of that unless you would wish me to do so, Chair. But what I would say is that when we had the report, I felt that it was a very positive report, and I was really pleased with the points that the inspectors had picked up on around some positive areas of practice. Prior to the inspection, we also had to do a self-assessment. So what I would say was the areas for development in the report actually mirrored what we had identified in our self-assessment, which we had submitted the previous December prior to the inspection. So I think it was very positive. There wasn't any surprises. The areas that we had for development, which I'll go into now, we already had on our radar, and we were working, had actions in place to address those issues. So briefly then, from the 4 areas, from the wellbeing perspective, I think the inspectors felt that we had a good understanding of our strengths and certainly areas of challenge, and that is, I guess, reflective of the way that we work in the management team in adult services, is that we have a very open dialogue with the teams and with users and carers, so we know what the issues are, we know what the challenges are, and we are consistently looking at how we can address those. The inspector found that we had a long-standing commitment and practical understanding and our vision of how to promote well-being for older adults. That we had a stable workforce, and I think that's really important because is that's not necessarily the same right across Wales, and I thank the staff all the time around their commitment, and having that stable workforce is an absolute godsend and enables us to work to the standard that we do. They said that certainly one of the areas for development was they felt that we needed to develop a quality assurance system, in that we had a number of elements of quality assurance, but it wasn't kind of brought together in a systematic way. And if it's all right with you, Chair, I won't go into the action plan at this stage. I'll just go through the headings. From a people's perspective around voice and control, under 3.2, the inspectorate felt that we embrace the principles of the Social Services and Wellbeing Act. And certainly when I spoke to one of the inspectors and got feedback, as we regularly did during the 2 weeks, one of the inspectors said, when I read the file, I felt I was in the same room as the individual, in that it was very clear when I was reading the file what that person wanted, and what their wishes and feelings were, what mattered to them. And I think, again, that's testament to the staff of the journey that we've been on the last few years about how we engage with users and their carers to listen to what matters to them. And also they acknowledge that the patch teams are developing people's resilience and independence. Again, this is a theme of the way that we've been working that I know members are well versed in, as certainly I've attended committee before, to update on where we are with the patch-based teams. It is a philosophy and vision about supporting independence. So again, that came out in the report. The inspectors also reviewed 10 capacity assessments as part of in their 2 weeks. And here, as you can see under 3.2, they said that people can be confident that consideration is given to mental capacity, and where required, mental capacity assessments and best interest decisions are undertaken. And again, I think what I would say, Chair and members, that a lot of work and effort has gone into supporting our staff and the training for our staff to ensure that they are working to a very high standard, and recognise that very early on in any conversation and interaction they have with those individuals and their carers.
Just on that point, I don't want to interrupt you, but I think that's very much evident from the report as well. In addition, the additional training that's been given to staff, and that's not just been recognised, that's been recognised externally, with the Falls team being given the award for the additional training they've undertaken regarding saturation and nebulizers and all that stuff. So there's some very positive things in there.
Under partnership and integration, their comments were the local authority had a positive and maturing relationship with the health board. And again, I think it's something maybe we take for granted on a locality and a regional level, that we work very well with our partners, particularly in the health board. That's not to say that we agree 100% of the time, but I think it is a mature relationship that we find that balance and a way forward that is mutually positive for both partners. And I think that the care planning and provision, that we have those conversations at an operational level and at an individual level. I think what we have is that vision of trying to do whatever's best for the person that we're working for, and I think that is, whatever conversation you're having, whatever level, that does come across. That we've put aside the us and them, and it's about the individual and what matters and what better outcomes that we can achieve. So I think that's really positive. And the prevention and early intervention, and say that people are supported to remain independent and wherever possible to remain or return to their own homes. As we said, that the vision behind our Design to Deliver and our transformation programme was that we reorganised to ensure that we could deliver against that prevention agenda and early intervention agenda, and that we're open to any new technology as well. I think one of the things that the inspectors, I think they also visited the carer centre during the 2 weeks, and there was a demonstration, I think, during that visit of what assistive technology we're using, and a lot of positive examples of that we're willing to try anything new and see what support we can give to those individuals in the community to see how they can test things out from assistive technology perspective. So I literally picked up those real high level findings there, Chair, but could I make some general comments if is that okay?
Yes, certainly.
I think what was pleasing with the report was there was a recognition that we were trying something different in Torvine in adult services, and that wasn't on a spur of the moment decision, as members will be aware. It was several years in the planning and the implementation around our transformation programme. But that our focus, which was kind of borne out by the report, was around that early intervention, prevention, promoting independence, positive risk-taking, reducing social isolation. So all the things that we'd set out to achieve and that were our principles that we were looking to achieve through our new way of working, then the inspectorate did find that those real positive examples, and I think it would be fair to say that when the 5 inspectors started in that first couple of days, I think it was, and I'm sure Anne will pick up on it, that I think it was quite difficult for the inspectors to get their head round the way that we worked in Torvine, because we had completely changed our model. We had turned things upside down, and made sure that everything was centred around that individual, and in some ways it didn't quite fit the model that CIW were assessing against. So for the inspectorate to gain that understanding and to pick up on those positives in a relatively short period of time, in 2 weeks, I thought was a testament to the inspectors for kind of hanging on in there and listening to what was happening, but also to all our staff around how they explained that, and for the users and carers of the service to sharing their experience, because as with any inspection, that the information that's gathered is from a number of areas. It's not just the staff, it's not just the individual of the carers. As I said, it's around partners as well. So a variety and wealth of information there. So I was just very, very pleased around the position of the report at the end of that. I would always expect from any inspection as for areas for development. So, as I said, we know that there's areas around our performance framework. We're wanting to bring that together. There is areas around our prevention and intervention, some very good practice, but the report highlights that they felt that it would be better brought together in a strategy. So lots of really good parts of the jigsaw, but they wanted to know how that fitted together more robustly. The integration, again, some positive comments about the community resource team, but some work to do there with how the community resource team and the patch teams are aligned, better aligned. And again, that was one of the things that we'd highlighted in our self-assessment around our ongoing work programme, around how we align the patch teams with the community resource team. Another two areas for improvement were around uptake of carers assessment and direct payments. And again, the carers assessment is something that we've identified probably for the last 2 years, around the low, 2 or 3 years really, the low intake of uptake of carers assessments, and which I think is quite reflective across Wales as well. And we've been working with our carers centre to see how we can improve that, and I'll go into that in more detail later, Chair, when we look at the action plan. And the direct payments. Actually, on the direct payments, I wasn't 100% sure if we'd really identified that as a major issue, but yes, there's always room for improvements for increasing numbers for direct payments. The other areas, I think, was safeguarding. Again, it was very positive to note that the inspectors have picked up on timely and proportionate responses within safeguarding. However, they had highlighted the low uptake of training around corporate safeguarding, training around safeguarding for corporate members. So that was another particular area that we needed to pick up on. I think that's given a bit of a flavour, but happy to go into this in more detail, as you would wish, Chair.
Thank you very much for that. Before we've had a pre-meeting meeting, and committee members have prepared a number of questions, but before we move on to that, I'd like to ask you, Anne, if you wanted to come in and contribute to anything. Jill mentioned that there was issues surrounding the actual methodology that has been implemented, perhaps differing slightly from the standard model that you had. So any commentary around that, or anything else you'd like to add, please? Thank you.
Thank you. I think Jill sold herself a little bit short, because a considerable amount of work had been undertaken by herself and the team prior to the inspection, because from the start of the 4 weeks that they notified that the inspectorate are coming in, then there's a considerable amount of work undertaken through sending us through all the documents that we request. But prior to that, in the meetings that I have with Jill as the head of service and with the director, there's a lot of information gathering and a lot of intelligence going on. And although Jill had been explaining to me about the model that they'd been using, I don't think it really hit home until we actually came in and started undertaking the inspection. And as Jill pointed out, we request a number of files that are picked anonymously. They're not aware of them. They're aware of the 16 that what we call deep track, where we meet with the social workers, the team manager, and if it's appropriate and they're willing, with the person and perhaps their families or carers. But the other 40 odd cases are just anonymous. We go in the system ourselves and then we gather the questions. And in the beginning, it was really honestly where we were thinking, oh my God, we can't make head or tail of this, because what we were looking at in our set out tools that we use for assessing wasn't fitting in. So we'd already made arrangements to go and speak with 1 or 2 of the teams, but we decided, didn't we, Jill, that we'd go out and speak with all the teams up in the north and the south, and especially the team up in the north, where the pilot had started. And we all went off separately over the first couple of days, and by the end of that week we really got it. And that was from the way in which we sat in, and we sat in for whole mornings of the meetings, the fishbowl. We spoke with staff, we triangulated that with when we went out and spoke with partner agencies, and especially the people and their families. And what we were coming back with is this model actually had got to the part of the act of wanting to know what that individuals, what their wishes, what their feelings, what it was that they really wanted to remain. And, you know, I've spoken with staff that have had to have very difficult conversations, because when you've got a family who want one thing for their older relative, but then you've got a person who's got full capacity and doesn't want it, you know, they want to remain within their home, the family think what's best is something different, and that social worker is advocating, but really trying to, you know, get all parties together and look at how this person, this services coming in, can be kept in their home. You know, it really did bring in, and we understood fully how the team all worked together. You know, there was situations where they were saying, we don't know how we can do this, and they really looked at different ways of working together. And sometimes that was only for a person to remain where they wanted to be for a very short period of time, but that part of time meant an awful lot. You know, I had one gentleman that all that meant to him was his dog, and yet they found somewhere that would take him and his dog, you know, later on. And that was it, you know. But for the family to understand that was very difficult, because they were really concerned about the gentleman. You also had sometimes where the family perhaps weren't acting in the people's best interests, but then that was followed. But that was what we found with the model. And because of those, it's a 10-day inspection, we're really in over 3 weeks. And by the end of that, we really got how the model worked. And I think one of the things for me is that the Directorate must have taken a considerable risk in implementing this model, because it's spread out a little bit more, hasn't it, in different local authorities in Wales. But I don't think they work as they got it like Torfaen Adult Service have got it. And it really did bring in how working this little bit differently has really got an understanding, but the amount of work that people have had to put in, because social workers were open and honest with us and said, you know, this was a major change to the way we were working. Some of us who've been around a very long time remember it the first time round, you know, when you went in. But for a lot of them, it was a learning exercise for them, and it was really a learning exercise for us as an inspectorate, you know, because we really had to be now thinking around. And what was really positive was then, because I'd spoken with Jill, and she'd explained to me that it had already been planned to work with Vanguard to review the model, because they knew it had come in, and like anything that comes in new, sometimes little bits of the process, you know, change, or people go off and do they were coming back in, reviewing it again, looking at what works, and that was really good. It was very, very positive. I mean, you know, it doesn't fit in all areas. You know, some areas it won't work, but for the areas that they've got it's another tool that will allow, you know, the service users in Torfaen to really have, you know, that their voices heard, because it was very, very clear in the documentation, because there was a number of files that you actually felt as if you were there with them, you know, even if the outcomes weren't always what people wanted, and you had to put up with that, but at least then there was the transparency there for people to understand it. Thank you.
It sounds very much like the change in approach that Torfaen has adopted has delivered a lot more positive patient outcomes.
Yes, and I think it's also allowed or moved towards the delivering of those different outcomes in a different way. You know, it wasn't like we go in and inspect in some areas and it's almost like a menu. You know, you either fit into this or that or that. or there's nothing there for you. Whereas with the approach of this Vanguard model, using the whole team and partners, because we were there was district nurses in these meetings, that there was OTs, they were actually coming up with alternatives that didn't always, that it wasn't a bit where, oh my God, this is going to be a massive financial package. Let's actually look outside the box. Let's look at people within the community, linking in with the community connectors, linking in with the links in the GP services. And sometimes it's the little things that people want. They may not want. There's one gentleman, he was saying, I didn't want a call 4 times a day for domiciliary care. What I wanted was one call, but a little bit longer, and people took that on board and worked with this gentleman that it ended up where he didn't need anything, because there was other areas in the community that he could link in with. But in a lot of places, we see this straight menu, and you're going to have this and you're going to have that, whether you want it or not. So I think it gave back. One of the social workers was saying to me, it gave them back the autonomy to actually be able to plan things themselves. And sometimes, they put something forward and it couldn't happen for a number of reasons, but at least they felt listened to, and actually the person was part of that plan as well. So I think it is a bit around of developing different services and for partners to look at done in areas of this report with the really positive partnership working, and that's at all levels, from health board down to, the voluntary, small little voluntary agencies, or the locality in some of the areas as well.
Thank you very much for that. Jill, did you want to add anything further, or shall we move on to the members'
I just
questions?
put on the caveat about done at significant risk. It was done with a calculated risk.
Yes. Yeah. Sorry, I didn't mean that, but for us looking across 22 authorities, I feel as the link inspector, for the director to take that risk was such a positive. It was calculated, and I didn't mean it, but it was, it was very risky, and a lot of authorities haven't gone down that way, and that hasn't been for the benefit then for the people working there and the people that they are actually working with. But it was such a change, a different way of working. It's really positive.
Yes, come on in.
I've had experience of involvement with the North Turbine patch team, and I've got to be honest, their name is glowing throughout Glenarvan, Cardiff and everything. I think what you've achieved up there is absolutely fantastic, and individuals are really, really praising you that they are allowed to make their own decisions, but with help from your team. Jill, congratulations.
Okay, I'd like to thank you both for the summation on the report and the very positive comments. I'd like to, if we can, now move on to the questions we've got from members who've had the opportunity to look at the report. You've actually answered certainly the first question that we had in terms of the notice period for the inspection. And you've touched on the second question that we had as well in terms of how the 60 case files were selected. That was at random, was it, or was there a different methodology? I know you said you met with some of the social workers.
If I go back, the thematic inspection that we undertook for adults over 65, that was within, I think we've done 11 local authorities by the end of it, and as we say, they're not aware. 4 weeks notice they have. The only files that they are aware of that we will be looking at are the ones, the 16 that we deep dive, and we know that with the audit systems, because we actually come in and we work on the same data system as what WCSS, which is what the social workers on. So we know when things have been put in and inputted into the files. So it's those 16, and why we make the local authority aware of them is that for us, that they can arrange for us to meet with the social workers and the team manager, and also for families or the person if they want to speak with us. And as the lead inspector, I picked those files, and they are picked randomly from, I think it was Jill. It was like the last 9 months people have come through and things like that. The other files they don't know about, because we just come in and we pull them up on the system, and they can be, they're within that remit that we send through, but they can be from anywhere. And then if there are anything on those files that we find that there may be issues with practice, or there may be some very good practice, there's a process where I meet with Jill and I can bring areas back every day. But as part of the inspection, there's constant dialogue going on, because obviously the IT person, they have enough of us because we get very confused with the IT system, so they have to help us find things. But the staff are so accommodating, everything we ask for, because the days are gone. I mean, I used to sit on the other side when the inspector would come in, and we'd have to get loads of policies, procedures, paperwork. We don't want to do that. We don't want to put, that onus. We know we're disruptive when we come in to a local authority. People have still got a day job that they've got to get on with, and we've got to fit in with them. So, what we say is that if there's any policies, procedures, just point us through your IT system and we can, find things. But staff are so accommodating on that. But with the questions which we ask, people are not aware of them. Partner agencies aren't, obviously they're on a theme, but sometimes we may pick things up on a file, or when we've gone out and spoken with people, and we come back in and we just change the slant a little bit. So, we need to get a really holistic feel for, the positives, but also we're also there to work with the local authority and be their critical friend, and point out if there are any areas of development, because that would be in the best interest, and then that gets followed through between Jill and myself.
Thank you very much for that comprehensive answer. We had a meeting, as I mentioned, but unfortunately not all the councillors who attended that are able to be here today. So what I'll try and do is I'll share the questions out amongst the committee members, but if any members are here, I'll try and direct those back to you. But where we've got spares, I'll try and share some out. But if you have got something that you specifically want to raise, then please let me know as we move through the question sheet. So, do you want to take the question, please?
Hi, it's Councillor Faye Jones. I'd just like to ask you what information you surveyed, and I think in a way we've got the answer in 2.3 of the report. But could you go into the results a little bit more from the survey, I wondered? Thank you.
As well as the self-assessment, what we've done is we've sent out a staff survey, and that is predominantly around areas, because we have said of the staff survey that the council does, but ours is a bit more linked more towards operational practice, supervision, training, it is more drilled down to the operational matters, and we had a fantastic response. I want to say it was something like 98% of staff. It was really high, and along with that came not just the scoring 1 to 5, but there was considerable narrative on the different areas, and a lot of that was around, which we were able then to speak with staff about, was the change of bringing in the model, and how some, as I've spoken to before, how some people were a bit, anything with change can be seen as sometimes as a bit challenging and a bit scary, but how they'd actually really moved and benefited from that. Considerable areas were around the support from not only within their teams, their line management, but also how open and able they are to actually contact senior managers. And that's really important to us, because local authorities that listen to the flow up, not just from the top down, I've got very, we find that that's when there's considerable areas where change can develop and good practice. And staff was saying about how, not only can, is Jill very accessible, but the director is Keith, the chief exec, and the relevant members as well. And, that wasn't just put on there was clear examples within the staff survey. And that's why we do the staff survey, because it allows us to have a deeper insight into what people think, rather than, because it can be difficult if you're in a meeting or on a one-to-one basis for people to speak at. There was also some areas which we were aware of, is around how, the financial impact is having on services. Everybody would like more, resources. So there was stuff, not everybody was happy with some of the changes that were going on, and usually that was around communication, and we raised that was the bit around the CMT. But that's what we did with the staff survey, and it gathers that extra bit of intelligence, because we can then tailor our questions towards it. We also put out surveys to the public, and we've had it's new. We've only been doing it the last year, and we're learning from that as well in various forms. But we do get quite a bit, if we link in with carers groups or through GP surgeries, and that usually comes back then about the resources that are out there, so that we can get a wider group. Because sometimes when we meet with some groups, you do tend to get the same group of people on a number of groups, and we really are trying to get what we call the harder to reach individuals. So that is the staff surveys. Okay.
Can I just ask a follow-on from that? You did surveys in the wider community. I don't know if you did any clients at all, if you surveyed any clients, but I also wondered, having seen how the patch works, would you be recommending it for other authorities?
We do send surveys out to people who access services, and we do them using the voluntary agency, and obviously the social workers can send them out we send them with self-addressed envelopes, so they can all come back to us. So we've had responses from them, and part of our role is looking at improvements and any developments around the 22 local authorities. Torfaen are very open learning council, and that proved that, because some of the frameworks around the performance, the QA, we just done, I think it was Anglesey or one of the North Wales ones, and they'd actually developed their framework, and instead of starting from scratch, reinventing the wheel, we asked if they could have a look at it, and we passed that on. So that's how we share some of the good lessons learned. but also part of our role is that I've gone back to speak with the other link senior managers, and I was speaking to them about the model here, and some areas, especially in North Wales, are using aspects of Vanguard, but not to the depth in which Torfaen are using it. But with some of the authorities then where there hasn't been such a positive report, we've actually gone, and we can't tell them to use, but we've said, look at the reports of other authorities, speak to your core, heads of service in other areas through your meetings, and see if there is areas that you can learn from, because, the current climate, everybody's got to start working together, haven't they? So that's how we go about it. And there will be, coming out in the next couple of weeks, it's actually with our translation service now, we do an overarching report over the whole 22 authorities on this theme. So that will be coming through again with specific themes coming through, and that is what we use then to inform Welsh Government.
Thank you, Faye. With your supplementary, you kind of led nicely or almost preempted the next question we had, which was how are we developing quality assurance systems, and are we using peer reviews? Now, it sounds very much from the positive things that you both have said today, almost as if Torfaen is kind of leading the way in this. The question was directed really to try and get a feel for how we compare to other local authorities, but it sounds very much from the responses given today that because of the changes that have been adopted here and the new approach, that would it be right to say that this could be used as almost like a best practice model for other local authorities, would you say?
I think it can be used for them to have a look at it, because some local authorities, the geographically they're different, some of the issues are different, but definitely, I think some of the approaches, a lot of them are using a number of models that have the same type of principles, but I think it's the way in which Torfaen has been adapted and the way the staff have come on with it. I think that's a learning, is how Jill and her senior management have brought staff in on that, because you can put a model in, but if the staff don't understand it, or and not it's not role model down from the top, it's never ever going to work. So I think that's some of the areas. I mean, the other part around the performance and the QA, it was there. What we weren't finding is that it wasn't gathering all the information, and where there was information, that sometimes wasn't being developed as it should. And we wouldn't have expected that, because it's like stages. A lot of work has gone in to getting the model in, to doing all the documentation that needed for WICIS, to get staff trained on it, to a massive cultural change for staff and families and service users. Something's got to go a little bit, and that was the side. But that was the next stage to move on. Now, in other authorities, it's the other way around. They've developed all the performance framework, but they haven't got the other bit embedded. And I always say, for my authorities that I link with, if I could take a little bit of this one, a little bit of that one, and a bit of that one, we'd get it right.
Yeah.
But you're not going to get that because of, different demographies, the different issues that are going on. But definitely, it is an area, and from the report, because that's one of the ways in which, there's a lot of learning done, is that I would hope that the local authorities that we haven't inspected are looking to these reports and looking at bits that they can be thinking, Torfaen have almost nailed that. I'm going to pick up the phone and speak to Jill. Like the way Jill, I was able to say, we've got a really good performance framework that's coming from Anglesey. do you just want to have a little look at it, just to see how things are going and link in with them? And so, I hope that answers the question. So, I wouldn't want you to think that there wasn't anything there. It was there, it just needed to move on. And that's got to come in the stages as you go along.
But before I ask you, Jill, would it be fair to say, and then that you see that as the next step of the evolution of the process is to focus a bit more now on the performance framework now that we've got the other piece in place? Can I take that away from your response, or?
Yeah, and it's already there, because there was an area that through their self-assessment, Torfaen had identified. So when we were doing the inspection, when we were putting the questions to them, they were able to say, we've got a member of staff identified who's going to be leading on this. So, and it's going to take a bit of time, because it's like anything, once again, it's got to come in, it's got to be embedded, it's got to run alongside the day job. So it wasn't something that came out of the blue that the director weren't aware of, but it's then bringing it in, and that's how we'll monitor it through the action plan.
Jill, did you want to come in?
Just quickly, Chair. As part of sharing the learning, on a regional level, there are ourselves and Monmouthshire that were part of inspections, and we have actually got a session with the other 3 heads of service to share learning regionally. Also from an All Wales perspective, because I am now chair of the All Wales heads of service, it is an agenda item that we share learning across 22 local authorities, and what are the main points that we can learn from each other from that perspective. From a locality perspective around the performance framework, as Anne said, we did make links with Anglesey, and also picked up some good practice. I think it was Oxfordshire actually, but it was outside as Wales. So we've developed our performance framework of really in a document that brings everything together. So if somebody came in, that's an A practitioner, they know exactly what we are collating, why, and what that means, what we do with that information. So that is actually done. And there is another area that we've also identified through some recent work, which I'll pick up in more detail later, around we, as a management team, looked at all our performance information, including the patch measures, to say, is it providing what we want? What is it telling us? Do we still need it? Is it consistent? So again, we've done that piece of work. So we've got a task and finish group that's picking up on some of the outcomes from that piece of work as well.
Thank you very much, both, for those comprehensive responses. Faye, do you want to come in with the next question, please? Yes, question number 5, collection and analysis.
That's just so me. Collection analysis of patch performance information. What aspects need further development? How is patch-based work performing a year on?
Okay, so pick that up. I just alluded to it briefly there. In November, we, as a management team, adult services management team, spent 2 days what we call a check plan do. So we actually spent 2 days out looking at what we set out to do as in our transformation programme, and asking ourselves the question, what's working, what's not working, and we did that from a number of different perspectives. We asked the teams to go out and have the conversations with users and carers, so we got feedback there. We also asked the staff, and we looked at the data. So from a data perspective, so that I just briefly mentioned there, we looked at the patch measure data and asked ourselves, what's it telling us? Certainly, one of the areas we found there that it wasn't as consistent as we would like across each of the patch teams. For some areas we were collecting data and actually it wasn't really telling us anything when we looked at the analysis, because if you look at averages, it wasn't really telling us anything. So we can refine, we've got Task and Finish group refining the data and working with our colleagues in our performance backup. So how do we collect that? How do we validate it? How do we ensure that we've got consistent approaches in place? So that piece of work is going on there. So where are we as a year forward? The other feedback that we had was around positive feedback from users and carers, but also some messages around consistency of they felt that there was definitely more consistency around the worker, allocation of worker, so that continuity. So those principles that we set out in the beginning, no handoffs, continuity of worker, listening to the person, what matters to them, ensuring that they're in control. Feedback that we had from users and carers was absolutely that's what we were delivering. Again, we also were probing because it is about a journey of improvement, so we were asking what areas could we do better. And one of the areas coming up there was around some consistency in domiciliary care practitioners, workers, carers. So that's something that we feed into our dom care strategy. So that's that information we feed back from a staff perspective. Again, some really positive feedback, and and for us it was about taking stock of, do we know where we are? Yeah, we think we do, but is that right? So we validated where we were with the support of Vanguard again, because we need that. Sometimes you need that critical friend, and again to agree what our next steps were and what our priorities were. So from that session in November, we asked ourselves a question: are priorities that we set before, are they still our priorities? And we agreed that those priorities still are around the dom care strategy, the community short-term hub strategy, and obviously around our the opportunity strategy. And then there were some other pieces of work that were coming from also stemming, which the teams agreed to take forward, because I think that's our approach. Is it doesn't always have to be myself at the helm. I mean, we've got absolutely superb staff in the teams as practitioners. I've got a superb adult services management team, and my group managers are absolutely fantastic. So it can happen at every level. So there is some work that's going to be taken forward through the teams particularly around the community engagement, which is where that needs to be held and owned. So we have a whole, again, that gave us confirmed our work programme with the teams and our vision again for the next 12 months, for the next 12, probably 3 years. So that's where we are about. I think it's really important to understand what you are achieving and what you need to still work on.
Thank you. So it's quite positive, really. It's developing it, isn't it?
Absolutely.
Faye, did you have any supplementary questions you wanted to ask?
Do the people within each patch get together with each other very often? So perhaps the patches from the north meet with the patches from the south and share information and things?
Yeah, sometimes we have, we've identified different areas around some task and finish work. So, for example, direct payments, where, how do we, and this is a piece of work that has been done, around, what's that flow, what does it look like, what does it mean for the member of staff, what does it mean for the person in the individual that's trying to manage their own direct payment. So when we work, the way that we work is that we have task and finish groups, and we ask for representation from each of the teams so that they can work together, because what we find is the way that we work is some areas might have a problem and someone else has cracked that. So, sorry, not a very technical term, but that they've found a solution for that. So we bring practitioners together so that they can also exchange their views and ideas as well.
Thank you.
Thank you. If you've finished, I'll ask Veronica to ask the next question, please. It's number 6 on our question sheet.
Yes.
Have you assessed how much resource have been needed to achieve that?
I think the particular reference there I've made to social enterprises, and actually it's been part of dialogue I've been having with Arno during our regular meetings, in that social enterprises need to come from the community up. There has to be community champions in order to develop a positive social enterprise. And the evidence, and I would suggest, and I might be able to comment after, this isn't just a Torvine issue, that those individuals need a lot of support. Sometimes you might just have some people in the community who are absolutely born leaders, and because social enterprise doesn't have to be, I'm not thinking of a big organisation coming into Torvine. A social enterprise can be, or that cooperative kind of value base. It can be as little as 2 or 3 people in a community, and sometimes you can have one person that can spark a whole community, but that's not an officer. An officer can support, but you've got to have that spark. And sometimes you need to go digging to find that spark. And the resource that you need is you need a dedicated officer to do that. The way that we're working, probably when I reread this report, because it's probably been a while since I penned it, probably the way I've written it's indicated that nothing is happening as far as social enterprise. Whereas if you approach it in that different way, of actually this is about bringing together a number of individuals from the community about working together in a collective way. Yes, we are doing that because we do that through the community connectors, through the facilitation of community connectors. I know that our senior officer who supports direct payments is constantly looking at is there any individuals out there with direct payments that would like to come together to pool the direct payments. Again, that's a different way of thinking about that co-production and those services led from the community. So it's not that we're not doing anything. However, I guess from a Welsh Government perspective of a true social enterprise, where there is probably a set criteria, no, we haven't got that in Torvine, but it is purely down to sometimes you have to look about where your resources are, what's the better outcomes that you can get from the input of those resources, and that myself and my managers have to make decisions constantly about where do we best deploy those resources to get the best outcomes for the individuals and for the council. And at this precise moment, that's not the priority. And it's something that I'm not saying that we're not going to take forward in the future. And certainly it is an area that one of my officers is particularly interested in, Jim Wright. He has a lot of knowledge around that area. However, he's heavily involved in the GovTech challenge at the moment, and absolutely right and proper. That's where his focus is. And then he's going to be heavily involved in the day opportunities review. And I guess out of the day opportunities review, there will be discussions about different models, and social enterprise, I guess, will also come out. I'm not going to preempt a discussion, but I would expect social enterprises to be considered as we discuss those alternative models. So I think it's about the right time for those discussions and those resources to be deployed. Sorry, I went on a bit then, but did that answer your...
Yeah, thank you, Veronica. That leads on to the next question we had that I picked up on. It's just when you've got a positive report, any sort of negative comments kind of jump out at you. So this one stood out to me as well when I read it as well, because the wording was the limited progress on the development of social enterprises has also been hampered by limited capacity as identified in the report and willing community participants. So for two things really, for social enterprises, would you include in that sort of community groups, local community groups? We've got a couple in my ward to target isolationism and getting elder people that live on their own the opportunity to meet up, whether it's for a lunch or a coffee morning. And you mentioned limited capacity and willing community partners. So what I asked was, one, for Jill, what are the main barriers to the community partners being willing to engage with us? And for Anne, have you identified any good practice in any other local authorities in this regard? So can I go to Jill first, please?
So I wouldn't say, Chair, that there are barriers for those connections with those community groups. As I say, when I look back at my wording on the report, I think I probably understated those connections that we have got in the communities. For example, there is a really positive piece of work that we're carrying out at the moment, and that we've surveyed older people in the communities around social isolation, and we're asking those individuals what matters to you, what would help, what difference actions would you like to be seeing, what activities would you like to see in the communities, and we've had a fantastic response rate, and that's been initiated through small task and finish group, again coming from the teams, where we're engaging with the communities and starting to look at that analysis. So when we get all that data back, we will be going back and making those connections with the existing community forums, also through our community connectors, seeing what's out there, what are the gaps, and then looking forward about how we can meet some of those gaps. We've also had those conversations about when we've identified some gaps, making available some and I'm talking very small pockets of money, because sometimes it's a difference of £50 to kind of kickstart something in the community. So we're doing that analysis and planning now. So I think when I read back, I'm thinking I probably underestimated what was, or undersold what is going on. So there isn't any barriers to those connections. So what I was probably, when I wrote that, well, I know when I wrote that, I was thinking probably all singing, all dancing, quite large social enterprises, which are the ones that you tend to hear about it in the press, really, and kind of benchmark against. So.
I'm finding that interesting, because I was having a conversation with someone at the weekend who's now retired but had been very involved within my local community before then. And he felt that so much of those links were missing, and the standard ones like the WI has disappeared and so on. But if you are charging those from beneath and getting them working, I think we as members might find it useful to know where they are so that we can direct people towards them as well, perhaps to help.
What I would ask, if there's anybody that you come across in your wards that want to kind of take up the gauntlet to certainly become more involved in the community, please let us know, and we can ask the community connectors to follow that up, or the team lead in that particular patch to follow up.
I wondered about the same point that you made there, Veronica, as well, in terms of raising public awareness. As elected members, we may or may not be aware of these particular organisations within our own wards, but I think part of it there is, I feel there's perhaps an opportunity for us to, if we increase public awareness that there are these organisations and these enterprises out there within the borough that perhaps residents might not be aware of.
Yeah, there should be. I mean, as far as some of the organisations, then they should be kind of recorded on Dowis. So if you went onto the website on Dowis, which anybody can access, and Google, you should be able to get kind of what's in your area. But that doesn't cover maybe the individual or the two people that are happy to kind of facilitate a day out or whatever. It doesn't go down to that level. And I think we've got to get the balance there right of about adult social care, adult social services. Well-being is really important. However, we are not the facilitators for everything that happens in the community around well-being, because there is that balance around, we want to support people to become as independent as possible, and then we've got our statutory duties. So when we look at the capacity within the teams, we absolutely say we want to build what we can do around the community, but it is about giving that facilitation and stepping back, because we're not in a position to be able to support all those community activities. But we're happy to try and facilitate those in the beginning, and to see what kind of advice that we could initially give.
Yeah, I think the question, Jill, was not so much about the social care team facilitating those residents who are staying at home to be able to attend those things like arranging transport or looking after them. It was that is an individual choice. Some individuals might choose they want to participate in that, and others will decide no, it's not for them. But in terms of information provision, that's where I was going with it. I didn't want to make the job more complex than it currently is, or extend any duty of responsibility onto the local authority beyond what the statutory requirements are. But I feel that there is perhaps an opportunity for information provision, because it doesn't cost us anything if we've got a care worker there who's going out to facilitate making the home more accessible with grab rails and stair rails and falls alarms and so on. At the same time that work is being undertaken, it would probably only take an extra 5 minutes just to make that particular resident aware that there were other things within the local area that they could access.
Yeah. And certainly when we are aware of that, I would expect that to be part of their conversation.
I think Jill probably knows I'm going to talk about this, because I've got a particular bee in my bonnet that we have several homes in the area where many older people live together in separate flats, but they come together. And at the moment, our housing provider, one of them, is reviewing whether they should stay or whether they should go. And I feel that these places do a lot to tackle isolation, and also that they're very good at perhaps social enterprise or being a hub for social enterprise and being a hub to encourage other people in. And as a county councillor, I feel like whereas social services doing a very good job on patch work, and I love the thought of what we're developing here, I also worry about throwing the baby out with the bathwater if we do get rid of some of these establishments where people live in flats around, you know, a communal hall, and how that works on so many levels for so many individuals, and how it can be a hub for the community. And I know, Jill, you've sent social workers into the home that I've tried to save, the Beaches, and because they're very good at helping each other and helping the community they live with. I just wondered, is that something that we could look into more, perhaps recommend that we could do for social enterprise? And also because it is tackling isolation, because I know of several issues in that particular home where people have saved somebody from, you know, being on their own and falling and things like this, because they go and check on them, and also somebody who was depressed feeling a lot better because of the community activities that go on there.
No, I would support your comments around there's absolutely a role and a need for those kind of like those community hubs. I won't comment, and I can't comment on the individual work of the RSL and around their reconfiguration. But what I would add, though, that I know that when they reviewed the criteria, social isolation and social support and networks was built into the criteria, wasn't it? The new criteria was previously it wasn't. So I think that is a real positive. And I now scheduled quarterly meetings in with Catherine Love from the local RSL, who's around that community. Certainly one of her roles is around that community engagement and ensuring that customer focus. So it is something that we could explore around. For me, it's about how do we know what's going on within the RSLs, that how do we support each other as organisations, partner organisations, to make the best use of whatever resources there are. And I mean resources as far as individuals in the community as well. I'm not on about just council resources or RSL resources. It's about sharing the knowledge, I think, and that's what certainly something that Catherine and I will try to achieve through our quarterly meetings as well, about what's the kind of the joint vision there.
Yeah.
Janet, you indicated you wanted to come in. Is it to ask a specific question, or did you want to take the next two on the list?
Working with people, I regularly go to Baker Street House. We've been trying to get Adult Learning to go in there and do some activities, but again, it's coming back to finances, because Adult Learning say they can't do anything unless there's a payment, but I know there are people there who would like to take part in some sort of activities, even gentle exercise, but again, it's getting tutors and it's getting insurance and indemnity. Is this something that you can help and liaise with Bronavon Housing on for this particular complex in Bronavon?
I've got to be honest and say no, really. If it is really between Adult Learning and as part of the council and Bronavon.
Okay. If we try to get involved, would you be supportive of having something like that to bring people together?
I'm supportive of any activities that brings that together, but unfortunately, it is some of the complexities that you start to come across then about insurance, indemnities, and it's something probably, as I say, that adult education and Bronavon need to kind of work through to find some solutions on that.
Yeah, that's okay, Janet. Would you like to take the next two questions, please? We combine 8 and 9. Thank you.
apologise. Why is there such a reluctance of people to identify as carers? Can we do more to educate people on the roles they play? And secondly, what has the impact of Care Support Post had since its implementation?
Okay. This is an area that we found in a number of valleys communities. I mean, I'm from a valley community myself, and it's this culture of we look after our own. You know,
That's right.
there's a lot of work being done, you know, with explaining carers assessment, you know, what is out there for carers. But, you know, these families do considerable, you know, work themselves before they even come knocking on the door. If any of them do come knocking on the door, you know, for social services to help. And I think it is that cultural whole makeup of, you know, we're a family, we look after our own. There is something about, you know, having help in, even when it's sometimes to the detriment of the person giving care. Because, you know, what we normally find, and from my previous role when I was, you know, a social worker, the person being cared for is being cared for fantastically. It's the person who's doing the caring or the extended family that is the one who's really failing, and it's usually when something happens to them is when it's at crisis point. And I think it is something that, you know, especially in the groups with the social workers and the team managers, that they've spoken about is it's not that carers assessments are not offered. You know, there was some really good work being done through going through the back door, you know, of actually saying to some families, you know, there may be a group down in the community centre that, you know, your husband can go to almost give them, like, you know, through the back door a bit of a break. But a lot of the families, it's like, well, actually, you know, I worry, can people care for him like I can care for, you know, that type of thing. And I think that is the whole bit, and that's what I'm saying about the culture of it, is actually how you work with those families around, you know. It is actually, you know, you've got a right, and it isn't about somebody coming in sometimes and doing the caring, it's about actually having a bit of support yourself. And, you know, it's about not sometimes even having to go to a group, just knowing that there's somebody that you can talk to, you know, just pick up a phone, or when the person you're caring for is in an activity, you can have 5 minutes to have a little chat, just to know that how you are feeling, you're not on your own out there. But it is very difficult, you know. I've got 2 other local authorities in Gwent where we've come across the same thing when we've gone in and done other work around the take-up of carers assessments. I also do some stuff, you know, in my previous authorities in West Glamorgan and in RCT, you get a similar bit around it. It is this bit where, you know, we've got this generation that they still care for. See changes in different pockets. You know, if you look at learning disabilities, especially with young people with learning disabilities, it's different. There's a big take-up of carers assessments. There's a big take-up of direct payments. But it's how, you know, we carry on, and how the local authorities actually try to crack this bit around carers assessment. You know, they do it by having carers organisations, you know, they do it by having somebody independent, but it's still this bit where, thank you, but we don't need it. And it's how then, it's the skill of the social worker or the care worker going in there to actually work around that with people. But it's something that we found by doing this, that there is that block somehow, and there's a number of local authorities that are in this issue. And it's not because they're not offered, it is because that people just don't, you know, they don't see themselves today as carers.
I'm speaking from experience because I'm a part-time carer myself, and the only time I've called upon anything further is when I've not been there, or I know I'm not going to, I'm not going to be there for a few days. But yeah, it's as and when. But I think there is this mindset that you can, as long as you can cope, you carry on doing it. Jill, you indicated you wanted to come back in on that particular point.
Yeah, I would agree with everything that Anne said. One of the things that we were asking ourselves in the 2 days that we were looking around Check Plan Do was, okay, what could we do differently? And the conversations that we were having with carers. And the feedback, some of the feedback we had was when we are completing an assessment with the cared for, there is a section in there that is what matters to the carer. So, and that's part of the assessment for the cared for. So, when we are then offering a separate carer's assessment, some of the feedback we're getting is, I've already told you what matters to me. So, why do you want to know again, kind of thing. So that's something that we're kind of testing out about. If we have recorded, if we're having that conversation with the carer about what matters to them and what would make a difference, if it's being recorded as part of the cared for assessment, can we still somehow take that into account as assessment, rather than then saying, well, actually, we need to do a separate piece of paper? Because really, and I can understand from a carer's perspective, they've already had that. Well, as far as I'm concerned, I've already told you once. Yeah. I don't want to do a separate assessment. So that's something that we're looking at, about how do we capture that. That's as far as, because that reflects in the numbers, and what part of this was actually, why are your number of carers' assessments low? And the carers' assessment basically is a document that's then recorded on the system. So that's why we try to unpick that and say, are we listening to carers? Are we hearing what matters to them? And what I'd be saying, yes, the feedback I've got is yes, that doesn't reflect in numbers. Okay, it doesn't reflect in numbers there. We don't want to duplicate for carers, so how can we kind of do that? And
can you review?
so what we're looking at is, and obviously we have to link back with Welsh Government, because this is about, there is criteria. So if we do it this way, does that satisfy Welsh Government as far as their performance requirements? Because we can't cook the books. We don't want to cook the books. We just want to make sure that we are offering and ensuring that we are listening to carers. That's what this is about. So that's what we're looking at the moment. And then which kind of leads on to, it's about, for us, it's about the carers' experience. That's the numbers, but it's about the carers' experience. And do they feel supported? And I think that the comment which leads on to the second part of the question, Chair, around, so what's the impact of the carer support officer? From Louisa, so that is around the feedback there is, what Louisa does is actually ensure that they have, that the carer is, what we hear is, I want to be pampered a bit, I want to enjoy a day out, sometimes with the person they're caring for, sometimes without the person they're caring for. So that's what the impact of that individual post is, that they're arranging all sorts of kind of pamper sessions and just social activities that are with and without the cared for. It's that social. It is the social aspect, and whether it's the bowling or whatever, and there's lots and lots of activities that certainly that Louisa has put in place as a result of that post. So really positive.
I guess it's from my experience, it's a very difficult thing, because you cannot really categorise a carer. You get the whole range of the elderly right down to very young. People can be involved in the caregiving process, and for the person requiring the care has varying degrees of needs as well. This is why, from my personal experience, I don't think I've ever felt the need to come along to a carers group or to have a chat with somebody or to say that I need to have a week's break, because for me it's not a full-time role. I still get freedoms to be able to allow me to work part-time. Yes, I'm doing the cooking, the cleaning, washing and ironing and other things as well, but it's not that the person I'm looking after is bedridden 24/7, whereas some people might be in that situation. So I think by nature of the role you're going to get some that will need more support because it's far more onerous on them as a carer, and for others it's not so onerous. So I appreciate that not everyone is going to want to have a carer's assessment done on them just to satisfy some bureaucracy to have a form filled out and filed away somewhere. But I recognise that there are genuine needs for carers that obviously would want to participate and to avail themselves of the facilities that are on offer for them, to give them some break themselves, you know. Okay, can we move on to the next question, please? We briefly touched upon this earlier. Do you want to take this one on? It's question number 10 on the direct payments.
Certainly I get regularly briefed by our officer responsible for direct payments. So we've got 3 staff that have to be transferred now in-house. And what they've done, I think I mentioned earlier about the Task and Finish group around direct payments, is that they've looked at the feedback from individuals using direct payments, from some individuals and from staff, was there's this perceived bureaucracy around direct payments. So again, what we're looking at is, can we make our own process more streamlined and less bureaucratic? Although I think what we found was part of the issue was the perception rather than the reality. But that said, there was still some tweaks around the system that we were able to put in place to make that better for the individual managing their account and for the staff as well, because there is this perception about, it's an awful lot of work to set up a direct payment. Actually, it isn't. So it's the staff transferred in. Well, there is a number of things so they've looked at the changes and they've streamlined the process and the paperwork. They're revisiting the training on direct payments, because that was one of the areas actually we touched on in our 2 days away. So they're looking at training on direct payments for particularly the PAs, because that's a big area where we know that if you're in the domiciliary care sector as a carer, that you access a number of training opportunities, so we need to make sure that the PAs, personal assistants, also have that same opportunity, so that's really, really positive. The direct payments working group were looking at developing new costing sheets, again, to look at that to make that easier. And they are going, also the direct payments workers that are transferred in are also going to do some work in the teams again. So we're going to look at how we promote the use of direct payments again. So again, lots of activity, and I think our numbers now are up to 161. So with slight improvement, going in the right direction to this time last year. Certainly they have. We have clients that come off, and then we have clients that go on, but certainly it has increased since this time last year. So again, it's an offer, but we're working towards making sure that it's an offer with a lot more kind of push behind it, shall I say. Ultimately it's down to the individual around their choice, but I think there's a way sometimes that you can offer.
Yeah.
Thank you for that. Faye, I'm not sure if you wanted to ask the next question, because a lot of it has been covered in the previous responses we've had, hasn't it? Okay. That was on positive impacts that have come to fruition since the transformation of the Design to Deliver programme, which I think you both have talked about extensively so far. So we'll move on to the next question, which is with regards to the closing down of referrals. Jill, if I could ask first, please. Although there's a clear procedure for the closing down of referrals, has that procedure itself been reviewed to see if it could be expedited in any way?
I think in the paper, Chair, I think I highlighted where that we do have systems in place, that we have checks and balances in place to make sure that this is in regard to safeguarding referrals. In that we have the team manager in the safeguarding unit regularly checks the database around closure of referrals, and also where there is a group manager involved, then we also have the group manager from the safeguarding unit making sure that their referrals are shut down as well. We have a running database, so we know the length of time referrals are open, and we regularly check on the reasons why, and there are some cases that are left open for some considerable time, but when we've looked at the analysis of that, that is where there's ongoing police investigations, and if there is an ongoing investigation from the health board, so outside professionals, we would not shut down a case where there is an ongoing inquiry. And as you may appreciate that some police inquiries, we have some cases that have taken 2 years. So we have, but I am absolutely satisfied we have a system in place, a robust system in place, that we monitor that regularly.
Yeah, thank you, Jill. I was going to ask Anne to come in on that as well. Did you feel that there were any parts of the procedures we used here in Torvine that could be altered or amended to speed up the process?
No, I mean, it's Jill's clearly explained. I mean, the area that we found were the ones that were outstanding were the ones that were predominantly partner agencies were the reasons why. But we mention it in the report because then that can be raised with partner agencies when we speak with them. And as Jill says, especially police investigations, you do get them that do go on. I think, if anything, there was just sometimes the documentation was very detailed, and sometimes that can just be a lengthy process, but then that's the transparency that is needed if anything does get called into question or if there's an inquiry onto it. But it was predominantly around the partner agencies and the length of time that they were taken for various reasons.
Okay, thank you very much for the clarification on that. I wasn't aware that there were circumstances beyond our control in some cases where we were reliant on other partner agencies.
Anything that is, it is the local authority's responsibility to record. So any adult safeguarding investigations that happen that come through Torvine come through our safeguarding unit, so we have the responsibility for recording those.
Thank you. Veronica, did you want to take the next question, question 14 on the list?
Apologies, I tried to get updated information a few earlier on this, in case it did come up. But it has been raised to the Corporate Safeguarding Board, and and I know that they were doing, it was raised as soon as the report came through, and they were identifying who need to be trained and monitoring that. But what I will do, if it's all right with you, Chair, is when I have that information, I will send it round to the committee members. I'm sorry, I don't have that information with me at the moment.
Yes, thank you very much. Faye, can I ask you to, you wanted to ask a question on third sector partners. Question 15, please.
It says in 3.4.3 that the third sector do not find it easy to help with the development of services, and I just wondered if we've spoken to the third sector partners to assess why they feel this is difficult.
I guess I was a little bit disappointed in that feedback from the third sector. In that, on the one hand, we have I think the feedback to the inspectors from the certainly external domiciliary care agencies was that they felt that there was really good engagement. And whilst it's very early on in our developments, they felt fully involved and engaged with the domiciliary care strategy. So that kind of encapsulates 14 external providers. The work with, I guess, the voluntary sector. We have certainly around some of the grant funding suggested to the voluntary sector that they work together, sometimes to do joint bids, and we've said that we're happy to facilitate that or support that, but there hasn't really been any uptake of the offer. So I guess I'm disappointed in the response to that, but what I have got is I know one of my senior officers met with TVA recently, so that we can look about how we can do some better engagement. They've also had they've got a number of new posts in TVA. So probably maybe 6 months, maybe not that long. But so I've also got a new group manager within housing and commissioning. So we've got a meeting next week, so that we can just do a little bit more of a round table meet and greet and ensure that everybody knows which each other's roles are, and to see how can we, what do they feel that. How we can support them. So to start to have a little bit more of an open dialogue, because it wasn't something that I'd heard before it came through in the report, really. Anne might be able to add some commentary to that.
Yeah, I was going to invite Anne to come in there.
This is why we undertake the inspection process in the way in which we do, and we go out and speak to partner agencies, voluntary sector. And when I drilled down and I was speaking to the part of the team that actually interviewed, they were voluntary sector. I think it was more around the changes over the last couple of years that have come in the different way in which grant funding has been done, with the cutbacks, much more towards ICF. And I think Jill has already spoken about looking at the ways in which, especially the smaller voluntary sectors, do need to look at different ways of applying for funds, whether it be, grouping together or doing different ways. And the bureaucracy that goes with perhaps sometimes getting, some of the grants, you've got to weigh that up. So, we were very clear that when we spoke to some of the other partner agencies, they were saying about how, they were working with commissioning, they gave us some really different ways in which they've been working with them, but it was the voluntary sector that felt a little bit left out. Whether that was on behalf of the council or whether it is because of the changes that have come through with the applications for grant funding, that perhaps they hadn't moved with the times, but it was something that we had to bring to the table, because of course when we spoke with them, they had mentioned it as well, you know. So
Yes, certainly, Faye.
I worked in the third sector for many, many years, and I do feel that at the moment the climate is very difficult, and as the third sector you do not have the guarantees that you get when you work for the county council. Also, the funding comes and goes, as you just mentioned, and you know, one person has to wear many hats, and I think at the moment third sector is very, very vulnerable, and I know from financial aspects we have to rely on them, but I feel their workers and everything are tiered down as far as rights and things are, and it would be nice if we could take more in-house, but I realise in this climate probably we can't. And I do feel for the third sector because they're always the poor relation.
I don't know if you want to add anything further to that, or can I go on to the next question? Because the next question is with regards to funding, if I might ask, please, Jill. Referring to page 20 of the report, 3.4.3, where the report specifically mentions funding. Inspectors also voiced their concerns regarding the sustainability of some initiatives funded through short-term grants. It references the Integrated Care Fund, and the division shares these concerns and has regularly expressed these to the Welsh Government. So the question I wanted to ask was, has the Welsh Government responded to the concerns raised with regards to funding through short-term grants?
Certainly with in relation to ICF, the commitment, the response back from Welsh Government is that they can only give commitment to the length of time of the office. So obviously they've got elections in Welsh Government elections in 17, 18 months, is it probably around that time frame. So that they cannot commit beyond that time period. So this isn't a Torfaen issue. It is right across Wales. They are. I think the feedback from all partners is consistent, and I do take the point that's being made around from the voluntary sector about going from 1 year to the other. However, we also have staff in many of the projects that are employed by the council and the health board in exactly the same position, because we are only on fixed term contracts because of the ICF, and I'm sorry, off the top of my head I couldn't tell you how many million it is across Wales, but it's a significant amount, and that is the response, in that it can only be the term of the office.
Okay, thank you. I mean, I guess with that in mind, there's nothing more really we can do other than to keep making the case for continued funding after the next lot of elections have taken place in the Welsh Government. Okay, thank you very much for that. The next question we've got was regarding further training, collaborative communication. Janet, did you want to take that one forward, please? It's question 17 on our list.
Okay. It's Appendix 1, 2.4. Torfaen's vision for patch-based teams was developed in collaboration with users. People felt some assessments captured the individual goals and objectives. There is a commitment to further improve the skills of staff in this area with training for all in collaborative communication and motivational conversations. Can you tell us how this is going?
Collaborative communications has been rolled out to most of the teams now. We initially we were trying to roll that out with internal champions, training champions, and what we found was that the reason there wasn't enough internal capacity. Whilst the commitment was there, we just didn't have the resources internally to do that. So we commissioned an external agency to provide that, with the support of funding from the Health Board. So that was very positive. So that is being rolled out as we speak. And I'm saying most of the teams, I'm sorry, it might be 4 out of the 5 teams, or the 5th team might have happened just before Christmas, but certainly and very positively received. The motivational interviewing is part of, it's something that we have on our training needs analysis every year, so it is part of our training programme every year, and that regularly comes out where practitioners are able to, as part of their development, apply for that training as well, so that is available.
Has all the training costs been covered by grants or
for the collaborative communications, all the training costs have been covered through money that was being made available to the Health Board. And the motivational interviewing is part of our annual training plan, which is covered by grant from the Welsh Government, training grant from Welsh Government.
Thank you. Faye, you had a question on the role of advocate?
Yeah, I was just wondering I need to turn this on, sorry. The role of the advocate, in cases where there are no relatives who will fulfil this role, have we got somebody who steps in?
Yes. Also, there was a new initiative last year across Gwent of an advocacy, what I would refer to as an advocacy brokerage. I think there was lots of different advocacy contracts across Gwent. A few of them that were up for renewal, and what we do as a matter of course regionally is that when we have a service like that that a number of people would access equally right across Gwent, obviously we try and collaborate where we can to see that we can bring extra value and a better service, and better outcomes for the individual. So it is part of the advocacy project. So if anybody that needs advocacy, now there is one number to ring, because it can be a little bit of a minefield, but the advocacy available, what type of advocacy, what are the skills of that particular organisation. So we have a one number now, anybody can phone in Gwent, and that is open to the public as well, and they will be directed to the appropriate organisation that can provide that advocacy.
A follow-up, does not mean they stand separate of the county council?
Yes, all the advocates are through commissioned through external organisations.
Yes, certainly, Veronica. Put your mic on.
What sort of areas do they cover in that case?
It might be around an individual advocate around best interests, with somebody who doesn't have any capacity, or if there is an issue around quarter protection. It could be an advocate for an individual who needs support around making choices about their life decisions, about whether it's going into a care home, staying at home. It might be support where there might be two different advocates for the cared for and the carer, who might have different views, but both equally entitled to an advocate. So there are a number of varying situations. So it tend to be there are some specialist advocates in around somebody lacks capacity, then you have advocacy maybe for somebody from Age Connect, or in particular advocacy around somebody with a learning disability. So there is separate advocacy schemes for children as well. So it can be as a member of the public, or as a carer, or as an individual, or even as a professional. It can be a bit confusing. So now we have a service that can direct you, that they have the knowledge and can direct you to the right skill set.
And Faye, did you want to come in with you've got the next question as well on GP surgeries?
Yeah, GPs. Has relationships with GPs improved around facilitating discharge, and possibly on wards as well? For me, I think it's probably two separate questions. The one is around GPs wouldn't necessarily be involved in facilitating discharge. However, so the relationships with GPs on the whole in Torvine is good. We have some pilot work being carried out in Blaenavon, where the team have offered direct access to GPs. So if somebody is visiting with the GP that day and they need to, and as part of that consultation, they feel there needs to be some intervention from the team, literally they can phone the office direct, and there's always somebody in the office, and they'll be part of that. They can go down and see that person. It kind of, again, the numbers are very small. But what we have found is sometimes that, the GP might dictate a letter that goes somewhere, and then that's sent, and then that goes to the team and whatever. Whereas actually, if you've got somebody on the third floor, it can be facilitated a lot easier. There's also some exploratory work in Lanarhaven surgery to see how we can work better with the GPs and support the individual clients, patients. Again, looking about how we can have some direct access conversations. So again, that's been very positive as well. From the hospital discharge side, it is again, I would say that, there are positive relationships, and I wouldn't like to put it in any other way. However, it would be remiss of me to say that there aren't challenges with that, because there is a constant pressure in the hospital, and there is a slightly different mindset of where we're coming from, is around promoting independence. It's about what matters to the individual, and it's about positive risk taking. We do find that sometimes a consultant or another professional has almost kind of made a decision about somebody needing long-term care, and once a professional medic has sometimes had that conversation with that individual or their carers, it's quite difficult to step back from that decision and trying to support that person to say there are different options. So, and again, we're not alone in that in Torvine, but unfortunately there is still very much a medical model, and in the nature of medicine, positive risk-taking isn't something that would be part of their culture. So it is it's an ongoing conversation. Yeah.
If there's no supplementary there, then Veronica, I think you've got one on communication pathways.
Top of page 38, paragraph 3.5 at the end there. It says, Torvine CBC will need to ensure clear communication pathways are in place for all staff. So the question is, are these in place yet? How is this being moved forward? Thank you.
I think this is part of the communication as well from the community resource teams about how we're taking forward some of the integration and alignment. One of the things that we've learned from that is that we have a newsletter which I complete as a head of service, probably not as regular as I should do. So there is something around that's an action from me about ensuring that those newsletters are more regular. And what we agreed was that before, those newsletters would just go to adult social care staff. Obviously, they will also go to housing and commissioning staff now, because that's part of the directorate, but they will also go to key parts of other organisations. So, for example, the health board and certainly the key managers in the locality so they can share across appropriate staff. What we also looked at was a separate newsletter for occupational therapists, because that is a specific stream of work, whereas certainly my newsletter would give the general principles and where we're going, what our priorities are. There's a whole quite complex work stream around occupational therapy, so that there's a separate newsletter that's been developed, which is then shared across the occupational therapists that are working within the local authority in the patch teams, the occupational therapists in the community resource team and on county hospital, and also the occupational therapists in Brunavon. So that covers all the work streams that are coming under that, including falls and work with the domiciliary care sector.
Any supplementary, Veronica? No? Okay, thank you very much both. Just to wrap things up, I'm conscious of time, so if we can keep it fairly brief, please, because obviously we need to allot a bit of time for members to discuss their responses and come up with recommendations. Slight change to the wording on this, but it's the same theme. Are we on track with the action plan? And do you feel there are areas in the action plan that will be particularly difficult to deliver?
As I mentioned previously, Chair, the majority of areas for development we'd already identified in the self-assessment, so we had planned pieces of work to address those issues. So yes, I would say they are on track. As far as impact, yes, and any it does have impact because it's on top of the day job. I wouldn't say anything within the action plan is it is part of our work plan of the management team in adult services. But as I have mentioned, there are task and finish groups that are happening within the teams there, and any process of change takes a lot of time. Particularly around that integration and alignment, when you've got two different cultures across the health board and the local authority. And what we did learn from our design to deliver work, preparation is key. So it's not the case of saying, oh, we'll hold a workshop. Certainly the group managers in adult services, the amount of time and commitment that they give to the thought and the development, the planning of those workshops is a huge commitment. So yes, we are on track, but some of those actions are not quick wins. They are not just a one-off task and finish group. So certainly I've mentioned the integration, that's ongoing work, the work with the communities, around engagement with the communities, and kind of showcasing our work and how we work with the communities. That's ongoing commitment. So it is all pressure on the teams and the senior managers to deliver that. We have done some some restructuring. As you'll know, Neil Howell has moved on, so we have done some restructuring and identified one of the group managers to support with the transformation work. However, that's not additional resource, that is kind of moving the resource around. So we hope that will give some support to the group managers in adult services to enable them to spin the plates as because they've got so many plates spinning. So yes, it's on track, but not without its consequences.
Thank you for that. Members, do you have any other questions? Anything come up at all during the meeting that you'd like to ask that we haven't already covered? No?
If I may. Is Torvine still having difficulty in commissioning domiciliary care packages? It's on page 41 and it's 4.9. I do apologise.
It's okay. Yes, Janet, and I think that we've got a report coming on domiciliary care on the 30th of January. So what I would suggest is, if there's any kind of any real urgent questions, by all means give me a ring. But the report would, I think, suggest to cover that one.
Sorry, Anne, did you want to come back in with anything? Or?
No, I'd just like to thank you for letting me attend scrutiny today, because, to really see the commitment from the whole council and the members to the report is really encouraging. And I would just be continuing monitoring things with Jill, and the next area that we'll be feeding back in will be the director's letter, which will be from March onwards, which usually comes before committee anyway. But just to assure you that Jill and myself are in constant communication, and that is a real positive for the local authority as well, because we don't always get that. Thank you.
I think that's come across actually, even to myself as the first time I met you, that there is that cooperation and that spirit of collaboration and working together. It's very much evident, and I wanted to thank you both for coming today, giving up your time from your busy schedules. I know you're both very busy people, and thank you very much for your contributions towards the meeting today, and your frank and comprehensive responses that you've given to the questions. So thank you very much both for coming. If I could invite you now to leave the meeting, please, and then members will go through the responses and formulate recommendations. But on behalf of all the committee, thank you very much again to both of you for coming.
Thank you, Thank you.
Members, did you want a comfort break to up to the toilet or drink of water or anything, or shall we press on? Okay. Right, so if I could just remind everybody the framework, what we're supposed to be bearing in mind. It's the purpose of the scrutiny activity is inviting us as a committee to consider the information contained within the report we've got in front of us, the full CIW inspection report, which is contained in Appendix 1, and the post-inspection action plan contained within Appendix 2. And, supplementary to that, is to determine whether the post-inspection action plan addresses the recommendations and proposals for improvement identified by both CIW and HIW, and to make recommendations or comments to the executive member for adult services and housing on any areas of further development or urgency within the action plan. So can I now ask Rebecca to detail anything that she's picked up along the way, please?
Thank you, Chair. Well, I have to admit, I'm struggling on this committee because everything that I would go to write as a recommendation, Jill would then answer on the work that they're doing. I assume as a committee you would want to commend them on the very positive report that they've had. I don't know if you wanted to make any recommendations you to pick up about the corporate safeguarding, whether you want them to re-look at that and go back to anyone who may not have taken that and pushed that again, so that everyone completes that.
Just on that point, yeah, we should note it. I'm not sure what we can do in terms of a recommendation, because Jill already gave a commitment to report back, didn't she, to the committee afterwards?
Yeah.
So
we make that point.
That you encourage all members
Encourage all members.
to complete it if they haven't already.
On the aspect of identifying people as carers, is there anything that we could do as members to work within the community to identify carers who may not, as Hugh says, are family members and they don't want, but at some time they can be support? Is there anything we can do to work with Jill to help progress that?
I think that's a good point, and I think it ties in again with the communication. I think perhaps, as I mentioned in the meeting, not everybody's going to want that kind of assistance, but certainly as far as the residents are concerned, in terms of feeding back information about the opportunities for them to integrate and get out more, I think that perhaps we could include that as a recommendation. I don't think I explained it particularly well, because Jill took it on board that I was saying, it would place some more onerous duties on the actual social services care worker, but that wasn't what I had in mind. I wasn't talking about escorted trips to a coffee morning. I was talking just purely about heightening awareness that there was a coffee morning that they could go to if they wanted to, if they were feeling isolated or lonely.
I feel family members take on roles of carers, but they don't want to be classed as carers. They think it's an automatic progression, but we forget that sometimes they need support as well. And how do we approach and how do we get in contact or identify these people? Should we be doing more as councillors to make a way that, just pick up the phone, we can put you in touch with the right people, because I don't think we support our communities enough.
So if I turn your recommendation slightly then to say to Jill and recommend that if there are any times where they feel that you as members with your contacts in your communities use that for communication, so it might be like communicating social enterprises or any events in the boroughs and carers if they feel, and vice versa, if you have anyone who you feel needs help in terms of identifying as carers, that you can pass that back as well.
Yeah, I think you're right, Bex. I think there's two aspects there to the communication. It both ties in with corporate communications. One is to the resident themselves and how we could improve on that, and the other one is to carers about support networks for carers. Do you want to come in? I've got Faye and Veronica both wanted.
Just carrying on from that, I think it can be very delicate. We do have to be very careful how we step into anything like that. I actually feel probably the closest support that most carers have is to their local GP surgery, and perhaps there should be some kind of newsletter that lists some of the facilities that are available and contact numbers, because a lot of people, certainly in my community, who are carers, are often quite a bit older and they are not always happy to use IT.
No, that's true.
Over this last weekend, with problems with recycling and so on, the number of people who said, well, we don't feel that we want to go onto the website to find out what's going on, or send a message because we don't know for certain that it's being taken up and worked on. Whereas if they've got that onus themselves, but having got the information, most people will make a phone call.
I've got to confess, I thought that was already the case because they have got it in my doctor's surgery in Killeen. There is a notice up on the wall for carers, but perhaps it doesn't extend to all GP surgeries, I don't know. It does in yours as well.
But I think if you could go out the 50s forums and the age concerns, they are the people who regularly see people who are vulnerable and lonely, and perhaps they can just talk, it affects the advocacy as well, because I don't think a lot of people are aware that they can get help if they've got no relatives, and I think there's a useful newsletter or contact, again going through age concerns, the over 50s forums in Glenavon, Pontypool, Cwmbran, and the GP surgeries.
Okay, do you want to note that then, Rebecca, as well, if there's consensus around that? Faye, did you want to come in with anything?
It was just wondering about a recommendation, and that could that be that we have a list as councillors on this committee of the task and finish groups that were set up to address
We've no
some of the
idea what they are.
problems? We can't, can we?
No, I was just going to say we've no idea what they are.
No, we've
so
no idea what they are.
Would be
So it would
helpful.
be useful if we could have a list of that, and then perhaps see the recommendations that they come out with, perhaps at a later date in one of these meetings.
Yeah, that would be my only other recommendation as to whether you obviously will receive a progress update on this report now when you receive your recommendation update report at the end of each scrutiny cycle. So you'll obviously want to keep an eye on how they're progressing with this action plan.
I don't know if any other members had any other recommendations. Couple of things I picked up on. The quality assurance systems and peer reviews. Yes, we are doing the peer reviews. They looked specifically at Anglesey and Oxfordshire, and there had been a QA officer appointment. I don't know if we wanted to ask anything more on quality assurance, or were members satisfied with the responses that we had there about the appointment of a new officer. I think what really struck me was how well we're doing in this particular area, and that the changes that have been brought in by Torfaen are definitely working and are far more focused on delivering positive outcomes for the patients. So I think really we should commend Jill and her officers for the work that they've done in getting this work stream into place, because as Anne mentioned, it's not just like attending a seminar, it's really a cultural shift for the way that they used to do it in Torfaen to the way that it's being done now, and I think it's delivering far more positive outcomes that are patient orientated. She did hint that perhaps the next thing would, in the evolution of the process, would be the performance reporting, didn't she? She said other authorities had done more on the performance side, but we'd actually done more on the actual deliverables. But if you like, it sounded like there were still some gaps to be addressed on the performance side going forward, and that was going to be the next step. That was something else that stood out to me. There's not really recommendations we can make regarding closing down of referrals, because that was circumstances beyond our control with other bodies, wasn't it? If we were awaiting the outcome of a police investigation or a health authority investigation, obviously there's nothing we can do about that to expedite the closing down of those referrals. We've got to let those take their natural course.
Well, certainly. Social.
Faye, did you want to come in with
I was
something?
just going to say, because this is a new way of working and we've seen it being set up and now we've reviewed it with the inspectorate, do you think we could review it again in perhaps a year's time, just to see it develop?
That's entirely up to you as a committee. Like I said, you'll obviously receive an update now in June, July time, so you'll have an update on the recommendations that you make now. And then you'll have visioning. So if you wanted to keep this as an item in your basket of items to review again in another 12 months, then that's entirely up to you.
Can I ask a
Yes,
question?
Dominic.
I think it would be important that we have regular updates of how the team are liaising with the social landlords. I mean, Jill said she's having a meeting now with a new person in Bronhaven, but I think if we could have regular updates of how we are communicating and how we are improving, you know, it's improvement of working together, that we are kept updated on that.
Are the members
think,
in
that
agreement
was
with that? Or?
Slightly on a different topic than what you're reviewing today, but I mean, she did say she's open if you wanted to discuss those matters outside of this meeting. She's more than happy to meet with you on those. But yeah, I think that's slightly separate to what you're looking at today.
Yeah, so what you're saying is we shouldn't include that as a
Not as a
recommendation,
recommendation,
not
as a
because it's outside the scope of what we've been asked to look
that's
at.
fine.
Yeah.
More than Jill would be more than happy
Okay.
to pick that up.
Does anybody have anything else they want to
Only
bring
that
up?
I think if we're looking at this again when the action plan is sort of progressing and reviewing it, that should be sufficient, and we can then incorporate it in our visioning for next year, because this is something that's quite onerous anyway, and we don't want to muddy the waters with it.
No.
They've got a clear vision
got a
at the
clear-
moment.
We need to see how it's
And if we're not careful, they went through a stage, if you recall, a few years back, where they were reporting on things which were no longer relevant, and it would be a pity to, by putting extra work on, which isn't perhaps necessary at this stage, we could end up doing the same thing, which would be a great shame.
Absolutely, and like we say, with scrutiny, you shouldn't be receiving update reports. So in terms of reviewing the action plan, you would only want to know of instances that have not been delivered or not delivered as they intended, etc. So, yeah.
In terms of delivery, the responses we got back to question 19 in connection with GP surgeries, Jill mentioned that there's a pilot work project going on in Blaenavon with direct access to the GP, and plus there was work being undertaken in Llanarhaven surgery as well, and exploratory work there was ongoing. So I think perhaps as a committee it would be useful for us to include it in the recommendations to have perhaps a further report or further update on how the work has gone that they've been doing in Blaenavon and Llanarhaven GP's surgeries.
Yes, so rather than, because that's not actually a recommendation, I'd note that on the action sheet then for you to receive some feedback on that pilot.
Yeah.
Is that okay?
Okay, that's fine. Anything else at all? Any other recommendations, notes, comments? No? Okay, members. The last and final item then is to hand over to Rebecca for detailing the item to be considered at the next meeting on Thursday, 30th of January.
Thank you, Chair. So as Jill already responded to one of your questions, this is the item, domiciliary care strategy, for the next meeting on the 30th of January. So that will be looking at what work has been undertaken to date to deliver that domiciliary care strategy, and what further plans are proposed to continue to improve the capacity and stability of the service further. So I've provided you there with the report pro forma, setting out what members discussed that visioning and what you would hope to see in that report. If you do think of anything else that you would like to see in that report, please either say now or drop me an email. Also, if you think of anyone you would like to speak to prior to the meeting or any visits, and also anyone you'd like to attend the meeting as invitees, please let me know and I will make arrangements for that. Thank you.
And we're going to have a pre-meeting
Yep.
meeting as per usual,
Sure.
Bex,
Yeah,
and
do questions.
will we get the invite sent out for that?
They should already be out in the diaries.
Okay.
It's the same day because there's council and a few other meetings on that week. So.
Smashing.
Perhaps we could have, if Rebecca could sort of send some questions out to people who are already having help from the carers, you know, and some feedback of, are we providing what they want? You know, in terms, is that feasible then? Thank you. This is off the record, isn't it? Oh.
I thought it was 6, but we'd have to find out for the next meeting. Yeah, it's more in tune with the next meeting, isn't it? Really? Yeah.
Yeah. Thank you.
Okay, members, I'd like to formally close the meeting then now, and thank you all very much for your attendance today and participation in the committee. I think it was really productive, so thank you very much.